evening to everyone and welcome to this wonderful evening bulleted point revision in pediatrics. There are some very good teachers in pediatrics. They will all be taking the sessions one or the other in the days ahead. But one of the greatest challenges of the NEET PG, FMG, INI-CET or any exam is how you summarize is very, very, very important. You need to have your own set of points in your fingertips, your own book in which you have written, right? I hope you're all maintaining that book. On the Incus app, we have created something very revolutionary. It's called as flashcards. There are 70,000 questions that you need to practice before you go to NEET PG. So on the Incus app, what we have done was, we created these 70,000 questions, like 100 questions, one deck of flashcards. You click on the question and then think what is the answer. You click, it will flip back, and then you can mention sure or not sure and bookmark the question. Like that, playing, you finish all 70,000 questions along with the explanations. And at least some 5,000 to 10,000 questions you will bookmark in the process in the flashcards. That is all what you need to revise before the exam. So please download the Incus app just for 999 rupees. 3-year subscription until you get the seat. There are 2000 HD videos, and also there is 70,000 MCQs as flashcards, and lots of quiz tournaments. Keep playing the quiz tournaments. Good to see Syed Misbahul Rahman and many more who are all online. So, Doctor, let us see rapidly how many bullet points in pediatrics for the NEET PG are we going to revise today evening. So, Doctor. Yes. Now, pediatrics is very interesting. Pediatrics and geriatrics. If you intervene very fast, correct the fluid electrolyte disturbances, mortality is very less. But if you take a little delay, electrolytes, which are rats, but they can roar like lions when it comes to mortality. So let us master the pediatrics. So doctor, what are the periods of growth? You call ovum 0 to 14 days, embryo 14 days to 9 weeks, fetus 9 weeks to birth. This is the most important definition which you need to know. Then when do you call perinatal period? 22 weeks of gestation to 7 days. 7 days after the birth is called the prenatal period. And that defines the viability. Basically, beyond 22 weeks, if pregnancy continued, means it is a viable fetus. Then postnatal period, you call newborn in the first 4 weeks, you call infancy in the first 1 year, 1 to 3 years you call toddler, 3 to 6 years is called preschool, 6 to 12 is called school child, and adolescence is 10 to 19 years is what you need to remember. Now, one of the favorite questions which is asked by the examiner. So Chandu Vamshi is asking, how do you define zygote? Wow, that's good. So, doctor, every day evening, one or the other teacher will take a class. Please download Incus app, pay 999 rupees subscription, 3 saal, 3 years, happily enjoy videos, PowerPoint notes, 70,000 flashcards, MCQs, everything. So these live sessions are mainly to bring some interactivity, but otherwise all this is there in the Incus app already. So Chandu is asking until when you call zygote. So Chandu, you need to go back to Incus app, review embryology, where we have defined everything, spermatogenesis, etc., etc. Now, intrauterine growth chart, IUGR chart. So it has an x-axis where the gestation in weeks, and y-axis where you have the birth weight is what you need to remember. Now, typically between 31 to 37th week, this is the time of preterm, 37 to 42 is term, and after 42 weeks, you call it as post-term. Then similarly, you have small for date, less than 10th percentile, large for date, more than 90th percentile. Between the two, you have the appropriate for date is what you need to remember in the IUGR. So Ellen Oswald is asking, sir, is it available in App Store? One good news to all you guys. Next week, both iOS and web version, even web version of Incus app is going to come into the market. Our developers are quickly building it because a lot of people requested, sir, Android may just for 999 rupees, you have killed everybody with a wonderful price, affordable price for everybody, that to 3-year subscription with so much content and every day newly uploaded content. Yes, sir. You're all the warriors, the fellow doctors fighting for COVID, fighting for PG entrance. So there's no point in exorbitantly charging you 40,000, 50,000, 30,000, plan A, plan B. There's only one plan. The plan called the plan of your becoming postgraduate at any cost. So that is what is all Incus about. So both the iOS and web version are going to come. Flashcards, quiz tournaments, videos, everything will become available even on the iOS and web version. Just wait one more week. So doctor, based on the IUGR chart you call small for gestational age, when less than 10%, 10th percentile, and if the weight is less than 2 standard deviation below the mean, 10 to 90th percentile is called appropriate for gestational age, and large for gestational age is more than 90th percentile, or if the weight is more than 2 standard deviations is what you need to remember. Lot of times a question is asked. Perinatal mortality rate is what? Neonatal mortality is rate. Means what? What is in denominator and numerator? Total number of births in denominator, number of perinatal deaths in the numerator into 1000 will give you perinatal mortality rate. But the number of deaths less than 28 days in the numerator, number of live births in the denominator into 1000 will give you neonatal mortality rate is what you need to remember. Thank you, Chandu, for a wonderful compliment. And I will be really, really grateful to you guys. On the Google Play Store, if you can give a 5-star rating and write a good comment on the Google Play Store, really it will help us to go up the ladder of competition with all this costly, today, education, edtech startups. They keep saying we want to democratize. Where is democracy? You're still charging the student 30,000, 40,000, 60,000, 70,000. exorbitantly. There's no point. There's no democratization. So we need, but they are all funded, heavily funded by all the venture capital and all the big game. So we want to go up the ladder, and please write a 5-star rating. Please give a 5-star rating on the Google Play Store and write a nice comment. And we'll be very happy for that, because our students are our brand ambassadors. And tell another 10 of your friends that just pay 999 rupees, you get 3-year subscription. Every day new content is being uploaded and you get flashcards, 70,000 flashcards, quiz tournaments, full-scale grant tests, and 2000 HD videos, everything you get on the Incus app. Now, any infant separated from the mother's uterus, regardless of gestational age, if he shows the signs of life, you call live birth. You call live birth. So if he's showing breathing, heart rate is positive, umbilical cord is showing pulsations, if there's a definitive muscle movement, so we do the assessment based on appearance. If you look at the preterm, there are no creases, abundant lanugo, all this lanugo hair, it's all preterm. So abundant lanugo, thin ear cartilage, empty scrotum, breast buds less than 5 mm, labia major or minora, which are prominent in the case of the female, baby girl. So that is preterm, right? Now what is term? Lots of skin crease, less lanugo, thick ear cartilage, descended testis, breast bud more than 5 mm, and majora covers the minora. Typically it is the term baby. So now, how do you do the antenatal diagnosis? One of the favorite questions of the examiner. It is called TIFA. Okay, what is TIFA? Targeted imaging of fetal anomalies. Targeted imaging of fetal anomalies. When will you do that? 18 to 20 weeks. And earliest anomaly that you can detect is neural tube defects. Between 19 to 16 weeks. Earliest neural tube defect that you can detect, anencephaly, between 10 to 12 weeks. This is what you need to remember about ultrasound. Now, if you look at trisomies, there are certain features which are very characteristic in antenatal diagnosis. So this is all called nuchal thickness, doctor. Increased nuchal translucency is classically seen, this finding. This nuchal translucency is seen in Downs, trisomy 21. Trisomy 21 is what you need to remember. Echogenic bowel wall, single umbilical artery, Gulf ball sign, choroid plexus cyst, they're all the features in antenatal diagnosis which is very characteristic. Lakshmi Prasad is saying, sir, grateful to you for providing such a wonderful coaching. Absolutely, doctor. In fact, there is nothing more happier than spending with all you guys, doctor, let me tell you. There are some wonderful teachers who are the recent NEET PG toppers. They will be more than happy to come and deliver some live interactive sessions with you and eager to mentor you, share their notes with you. Everything happens on the Incus app. So please, let us make learning affordable, accessible, anywhere, anytime, and just for 1 rupee a day cost. Now this is called strawberry skull. There's a flattening of the occiput with a pointed appearance of the frontal bones. Typically it is seen in trisomy 18. Then one of the favorite MCQ, doctor, you like it or you hate it, I don't know. You have to remember these numericals. Definitely they will ask in entrance. And let me tell you, I was the poorest guy, never used to remember these stupid bloody things. But entrance exam requires you to show some dedication to numbers. Chorionic villus sampling between 10 to 12 weeks of gestation. Always remember, see, tomorrow, all these are the very practical things if you become a gynecologist or a pediatrician. If you become tomorrow general medicine, cardiologist, neurologist, they are all not relevant. But for entrance exam, you have to read every stuff. 10 to 12 weeks, 10 to 12 weeks, 10 to 12 weeks. Don't forget chorionic villus sampling. And basically, it is aspiration done from the trophoblastic cell. Amniocentesis, when will you do, doctor? More than 14 weeks of gestation. Percutaneous umbilical blood sampling, PUB, otherwise called chordocentesis. It is also another important antenatal diagnostic tool. CFF-DNA testing. Cell-free fetal DNA. Cell-free fetal DNA. Typically, it is done in the maternal serum. It is useful for diagnosis by karyotyping and single gene disorders. For all the single gene disorders, like cystic fibrosis, you do cell-free fetal DNA testing is what I want to underscore to all of you. Now, let us look at the care during the birth. 5 C's you should remember, doctor. Clean hands, clean surface, clean blade, clean umbilical cord clamp. And clean and dry umbilical cord is care during the birth. You have to prevent hypothermia. So the delivery room temperature should not be air conditioned. It should be 25 degrees Celsius. AC nahi lagana, 16 May, 25 degrees Celsius. Sterile warm towel which covers the whole body. Then what do you mean by delayed clamping of the umbilical cord? If you are delaying it to 60 seconds to 1 minute, that is 1 minute. After 1 minute, if you clamp. Advantage is that will enable extra blood and prevents the anemia in the later childhood. Now, how do you clean the baby? This is called vernix caseosa. What is that called, doctor? Vernix caseosa is what you need to remember. So never remove this vernix caseosa, because the main purpose that God has given this vernix caseosa is to prevent hypothermia. And the vernix caseosa become absorbed on its own after some time. And do you want to give a bath to baby immediately after newborn? No, sir. He did not come from United States of America special flight. He just born out of the mom. So postpone the bathing until the fall of the umbilical cord is what you need to basically remember. Good to see Kaustav, Patra and 24 more classmates. I hope you all have downloaded the Incus app, and we will also send a notification to you before the start of the class. Lot of teachers, NEET PG toppers, recent NEET PG toppers, they all love to come and deliver a 1 to 2 hours of interactive session with you every day free on the YouTube. So that is a great advantage. Knowledge is free. The most beautiful things in the world are free, doctor. The love of the mother is free, right? A lot of times we pay 40,000, 50,000, plan A, plan B, and all that for a simple mobile app, thinking that it will motivate us. Not really. You have to motivate yourself. Whatever be the number of apps, self-motivation is most essential, doctor. All the job of everybody, every teacher is to stimulate you to assimilate the complex facts that spread across 19 different subjects, right? Now, the weight recording can be delayed up to 24 hours if resuscitation is required. Then when will you initiate breastfeeding? As soon as after the birth, within the first hour, not less than half an hour, you should initiate the breastfeeding. That's what you need to remember. Now, 5 to 6 points about the vitamin K administration. Bhaiya, vitamin K kaise dete hain aap? Intramuscular. If it is less than 1 kg baby, 0.5 milligrams. And all other people, 1 milligram. And now what are the 10 steps of the warm chain? Delivery room should be warm. Resuscitation should be warm. Drying should be done immediately. Skin to skin contact with the mother will typically bring warmth. Similarly, breastfeeding, delayed bathing, appropriate clothing, they are all the 10 steps of the warm chain. Mother and baby should be together, Then warm transport, professional alertness, all these 10 steps will prevent hypothermia, is what you need to remember. Now, doctor, there are certain normal newborn phenomena. INA-CET ho, NEET PG ho, FMG ho, MBBS final year exam ho, any of them, basically, this normal newborn phenomena you should not forget. Mongolian spot, milia, miliaria, Epstein pulse, salmon patch, erythema toxicum, pustular melanosis, harlequin skin change, subconjunctival hemorrhage, vaginal mucoid discharge, hymenal skin tags, breast engorgement, natal teeth, acrocyanosis, golden yellow stools until first week, and 10% weight loss in first week. Normal. Definitely examiner will create one story and ask you, Bhaiya, do you know that what are the normal newborn phenomena? You have to be 100% sure about this. Doctor, Mongolian spots. These are all Mongolian spots, right, doctor? Sacral, greenish black, slate-like macules, to arrest of migration of melanocytes. Then, doctor, what are these called as? Milia. These are all called milia. Tomorrow, this will be given as image-based MCQ in the NEET PG. Small white dots because of the blockade of the sebaceous glands are called milia. Miliaria. So, what is miliaria? It is the accumulation of the sweat beneath the obstructed eccrine gland. Obstructed eccrine gland is called miliaria. Epstein pearls. Pearls, मालूम है ना? Nizam, Hyderabad is very famous for pearls. So, it is seen in the palate, white lesions, sometimes even in the tip of the penis. Then salmon patch. It is also called nevus simplex or stork bite. So these are called salmon patches. Remember, doctor, salmon patches are most commonly found on the nape, glabella, eyelids, and they are usually symmetrical, appearing on both the eyelids and on both sides of the midline. Whereas Portman stains are usually present at birth, and they can occur anywhere on the body. It is not just glabella, eyelids. They can occur anywhere in the body. But the most common site is on the face. That is what you need to basically remember. So salmon patch, nevus simplex, stork bite, cutaneous hemangioma, which is symmetrically seen on the head and neck. Then erythema toxicum, most common of all these things. It is a misnomer. It is a papulopustular lesion, is what you need to remember. So papulo, it is a papule. Pustular containing pus lesion is erythema toxicum, nothing to worry. It is normal in a lot of children, is what you need to remember. Then pustular melanosis. This is called pustular melanosis. It is a dark brownish pigmented pustule and it is also transient. Then harlequin skin change. Typically preterm differential vascular tone is responsible. And subconjunctival hemorrhages are very common in vaginal delivery. They are confined to the scleral area. And reassurance is enough. And even retinal hemorrhages are also considered to be normal if they are small in the newborn baby, is what you need to remember. Similarly, vaginal mucoid discharge, क्यों होता है? Because of the metal estrogen. Hymenal skin tag, because of the metal estrogen. Breast enlargement due to metal estrogen, considered to be normal. Then some kids will have natal teeth, newborn natal teeth. It interferes with normal bleeding and that can lead to the breast sore in the mother. And there is a risk of aspiration of that natal teeth, is what you need to basically remember. So sometimes it can be pathologically present, like Ellis-von-Crevaux syndrome, Pivy-Robin syndrome, natal teeth, you should basically remember. Then similarly, acrocyanosis, if the extremities become sinused, normal in newborn, don't worry. Golden yellow stools are called transitional stools. 10% weight loss in first week is still considered to be normal, is what you have to basically remember. Wow, very good. Thank you, Ankur Sharma, for joining this evening. Sir, I have subscribed for 999 plan on the app. I'm so happy to know about that. So 70,000 flashcards are there, doctor. Remember, please go to the NEET PG. In the courses, you have flashcards. In that 70,000 flashcards, they are all arranged like 100 questions, like a deck on the Incus app. You click on the question, you will find the question, click on, think what is the answer, then click, then it will turn back. Then if you are sure, fine. Say I'm sure. If you're not sure, say I'm not sure, and it gets bookmarked. And the last moment you can only revise. Like that, खेलते पूरा 70,000 MCQs को खत्म करो और not sure cards का revision करो. Seat नया है तो मेरे नाम मुरली भरद्वाज नहीं, right? Even if you are sitting in a garden, you are in a hospital, you are in canteen, you can just play one deck. Just like people say, no, let me take out the cigarette pack and smoke. Like that, flashcard deck is like a pack of cigars. Just take out the flashcard deck in the Incus app, play 100 cards, front, back, front, back, front, back. In the back, you are having explanatory answers. And bookmark, whatever you are not really falling sure. And whenever chance is there, try to revise those bookmarked and not sure flashcards. Easiest way to crack the NEET PG entrance. Right, doctor? So give me a feedback once you are feeling better as you are playing the flashcards on the Incus app. Now, doctor, IUGR. Typically, trisomies can lead to it. Congenital anomalies can lead to it. And what is meant by symmetrical IUGR? Entire baby is small. That's called symmetrical. Now, what are the various causes for the intrauterine growth retardation, doctor? Placenta, there may be issues like placenta previa, abruptio placenta, anything that decreases the placental vascularity can predispose to the development of intrauterine growth retardation. Similarly, in a twin gestation, there is an IUGR. Whenever the placenta is the cause, typically it is an asymmetrical IUGR, where head is normal but entire rest of the body is smaller. Whereas whenever the baby is the underlying cause of the IUGR, generally it is the symmetrical IUGR. That's the point. Then even material causes like undernutrition in the mother, chronic diseases, over diabetes, and gestational diabetes does not lead to IUGR, but overt diabetes can lead to. And once more, whenever the mother is the cause, it is a asymmetrical IUGR is what you need to remember. Similarly, if the mother is on long-term steroids, like she had rheumatoid arthritis or SLE or any condition, or she has hypertension on beta blockers or any anticonvulsants like phenytoin, then that can lead to development of IUGR. So, small for gestational age plus fetal growth restriction together constitute the intrauterine growth retardation is what you need to remember. Now, how do you clinically identify IUGR? There's a wasting of muscles, loss of subcutaneous fat, skin folds become very loose. Then how do you manage the IUGR is a very important question. Wow, that is really great. Ramakrishna Lingari said, I have subscribed to this 999 rupee package. Thank you so much for doing it. Please tell all your friends also, doctor. And please go to the Google Play Store. 5-star rating देना है आप और एक अच्छा comment भी लिखना है आप, because I am giving you a Boeing 707 aeroplane at the price of a bullock cart, right? But it has the speed, capability, power, content, questions, question bank, testing, quiz tournaments, flashcards, everything more powerful than any other app which has plans only. Plan A, Plan B, Plan D, 70,000, 60,000, 50,000. Oh, that's all stupid prices. You need only one app, that is Incus app. So, doctor, thank you very much, Ramakrishna, for subscribing to the Incus app. Now, if you look at the Doppler blood flow, the umbilical artery diastolic blood flow is very important, doctor, for identifying IUGR. Typically, if there is intrauterine growth retardation, the diastolic blood flow becomes less, or it becomes absent, or it can even become reversed. That is the very important indication of intrauterine growth retardation and intrauterine death is what you need to remember. So, doctor, this is the uterine artery, iliac vein. So, if there is a good, this is systole, this is a good diastolic flow, whereas this is called poor diastolic flow. Let me show you. The normal blood flow, you have a systolic peak and you have an end diastolic flow, end of the diastole also. This is called, there is no end diastolic flow in the umbilical arteries. That means there is a lot of vascular compromise to the fetus. And yaha completely, it got reversed. So it got reversed with diastolic. This is systolic, and here the diastolic flow got reversed. It indicates extreme fetal placental compromise is what you need to emphatically remember. So now, amniotic index. Amniotic index is less than 5 millimeters. That is also indicative of IUGR is what you need to remember. Now, doctor, cardiotocograph. If you do the cardiotocographic assessment, All these IUGR babies are prone for hypothermia. Why they are more prone to hypothermia? Because they have a larger surface area because head is largest. Decreased thermal insulation because they don't have subcutaneous fat. They have got a reduced amount of brown fats. And they are all the things that make them prone to hypothermia. Now, what are the consequences of hypothermia? The child becomes lethargic, prone for hypoglycemia, prone for sepsis with IUGR. And how do you measure the temperature, doctor, to discover hypothermia? It is axillary because rectum is sensitive to rupture. That's the reason we don't do rectal, only axillary. Axillary duration is 3 minutes, but if rectal done, the duration is 2 minutes, where you have to place the thermometer. Now, if you look at the ways of temperature loss, convection, evaporation, conduction, radiation. There are various ways a newborn baby is losing the temperature. So what are the 10 steps just before we discussed? Delivery room should be warm, 25 degrees Celsius. That's the point. Already we discussed what are the 10 steps to prevent hypothermia. So, typically, if you look at not hypo, hyperthermia. When you call hyperthermia, doctor, so you should remember, when you call hyper, it's not hypo, hyper. Temperature more than 37.5. Commonly, it is the dehydration that leads to hyperthermia. And in sepsis, they will be fluctuating between hyperthermia and hypothermia. Always correct dehydration, increased breastfeeding, which is considered to be the first line of management. Now, low birth weight. How prevalent is this low birth weight? LBW is a very, very, very important question. 30% babies are LBW, doctor. In that, 1/3 have prematurity, 2/3 are small for gestational age. Within LBW, you have two things: small for gestational age and prematurity. One third are premature, 2/3 are small for gestational age, is what you need to remember. So what is the etiology of the prematurity? Any previous history of preterm baby in the mother? Any teenage pregnancy, multiple pregnancy, acute systemic disease, chorioamnionitis, any of them? So how do you identify prematurity? Breast nodule, genitalia, sole creases, ear cartilage recoil because head size is bigger, and loose skin folds, lack of subcutaneous tissue. Small for gestational age in the LBW, under the LBW category, you have prematurity and SGA. Small for gestational age under LBW is equal to IUGR, is what you need to remember. So, be very sure, doctor, you call LBW if the infant has a birth weight less than 2,500 grams. Very important MCQ in the tomorrow's NEET PG. Then small for gestational age is defined as estimated fetal weight or abdominal circumference is less than 10%. You call severe SGA whenever the estimated fetal weight or abdominal circumference is less than 3 centile is what you need to remember. So what are the important clinical problems in preterm and SGA? In preterm, hypothermia, birth asphyxia, respiratory distress syndrome because of the immaturity, sepsis, apnea of prematurity, hypoglycemia, hypocalcemia, anemia, they're all the issues. Whereas the small for gestational age, which is synonymous with IUGR among the LBW babies, meconium aspiration, hypothermia, hypoglycemia, polycythemia, they're all the important problems is what you need to remember. So now comes a very important question, doctor. How you feed LBW infants? It depends on two factors. What is the level of sickness? What is the maturity of the feeding skills? So typically, if it is a sick child, then you need to give parenteral route, that is IV fluids. If the child is in the first 2 days, you give 10% dextrose. More than 2 days, you give isolate P. Isolate P is what you need to remember. Then, what is the feeding skill? What type of feeding? More than 34 weeks, it is safe to start direct breastfeed. 30 to 34 weeks, spoon, paladai. Less than 32 weeks, nasogastric tube, called garage feeding. Less than 28 weeks, never breast milk because of the gut's immaturity. And there is a feed intolerance. So always you have to give IV fluids if less than 28 weeks is what you need to remember. Now in a LBW baby, what is the choice of milk? Always the choice of milk is breast milk, unless the formula feeds are indicated. And how much to feed is important. It is all depending on the stomach capacity. Typically, stomach capacity is 2% of birth weight. So smaller the babies, lesser they can be able to receive the feed. So what are the nutritional supplements you give for the preterm babies? We give calcium, 120 milligram per kg per day. Don't forget the dose. Examiner will be unhappy. Iron, it is only started after 6 weeks. After 6 weeks of age. 2 to 3 milligram per kg per day till 1 year of age. Folate, 30 microgram per kg per day. Zinc, 0.5 milligram per day. That is the nutritional supplementation for the preterm babies is what you need to remember. And the folic acid and zinc, it should be supplemented until 40 weeks of corrected age. And if the baby is 34 weeks, then for 6 weeks. All babies require vitamin D, 400 inhalation units per day up to 1 year. And when do you suspect intolerance to the feed? If there is any persistent vomiting or the nasogastric tube has more than 25% of the previous feed, that is what you need to remember. So what is the etiology of inadequate weight gain? Suppose if the baby is not gaining the weight, what is the common reason? A lot of times mothers are apprehensive. Maybe the feeding technique is inadequate or incorrect. There may be infections, improper nutrition, supplementation, etc., etc. So how do you manage an inadequate weight gain? First, properly you should counsel. What is the correct technique of feeding? Then you need to demonstrate the feeding technique, how the mouth of the baby and the nipple of the mother should fit. Then milk fortification, fortified by adding human milk fortifier in the case of the preterm babies. Now, let's take a few comments on large for gestational age. Whenever the baby's weight is more than 90th percentile, you call large for gestational age, or more than 2 standard deviations above the mean value. What is the cause? Mera Anna is large, Mera Akka is large, Mera Didi is large, I am also born large. Constitutional is most common. Similarly, large for gestational age, infant of a diabetic mother. Then Beckwith-Widman syndrome. You should know what are the components. Hemihypertrophy, macroglossia, umbilical hernia, omphaloceal, earlobe creases. That is called Beckwith-Widman syndrome is what you need to remember. Similarly, Sotos syndrome, where there's a cerebral gigantism, necidoblastosis, beta cell hyperplasia. They're all the various important things you need to remember when it comes to large for gestational age. अच्छा भैया, large for gestational age है तो क्या problem होगा? There can be birth injuries, birth asphyxia, hypoglycemia. And if baby is large at birth, there's a chance of adult obesity. That is all we need to remember. So, Doctor, Shanti, Shanti, Shanti. All these videos, PowerPoints, everything become uploaded into the Incus app. You can happily review. Already all these things are there. Different teachers have taught on the, there are almost all 8,000 videos, 2,000 HD videos on almost all every topic, every question discussion on the Incus app. It's all depends on your energy levels to do the revision. So don't forget, download the Incus app, 999 rupees, 3-year subscription. आराम से पढ़ाई करो and become the NEET PG Topper and send me a laddu on the WhatsApp. बराबर? Thank you very much.